Coming to the physiology of the bone. Bone is a special type of connective tissue with a collagen framework impregnated with calcium and phosphate salts, particularly hydroxyapatites. It is a living tissue that is well vascularized and has a total blood flow about 200 to 400 ml per minute in adult humans. The protein in bone matrix is mostly type 1 collagen. There are two different types of bone. One is compact bone or cortical bone. Another one is trabecular or spongy bone. Compact bone makes up the outer layer of the most bones and it accounts for 80% of the bone in the body. Surface to volume ratio is low and bone cells, that is osteocytes, lie in lacuna and they receive nutrients via Harvesian canals. Trabecular or spongy bone, it lies inside the cortical bone. They are made up of spicules or plates, makes up remaining 20% of the bone in the body. Surface to volume ratio is high. Bone cells lie on the surface of plates. In spongy bone, nutrients diffuse from ECF into trabeculae. Bone growth. During fetal development, most of the bone are modeled in cartilage and then transferred into bone by ossification of endochondral bone formation. Certain bones, that is bones of skull, are formed directly from mesenchymal cells. It is also called as intramembranous bone formation. During growth, specialized areas at the end of each long bone, which are called as epiphyses, are separated from the shaft of bone by a plate of actively proliferating cartilage, the epiphyseal plate. The width of the epiphyseal plate is proportionate to the rate of growth and is affected by number of hormones like growth hormone and insulin like growth factor 1. And linear bone growth ceases after the epiphyses unite with the shaft, which is called as epiphyseal closure. Bone formation and resorption. Bone is constantly being reabsorbed and reformed, which is under the cellular control of osteoblasts, osteocytes and osteoclasts. The cells responsible for bone formation are osteoblasts and the cells responsible for bone resorption are called as osteoclasts. Osteoblasts, they are bone forming cells and they are found on the outer surface of the bones and in bone cavities. They synthesize and secrete collagen, forming a matrix around themselves which then calcify to form a new bone. They have abundant alkaline phosphatase activity. Osteoclasts, they are phagocytic multinuclear giant cells containing numerous lysosomes. They erode and reabsorb previously formed bone. They contain several acids and appear to phagocytosize bone, digesting it in their cytoplasm. Osteocytes, they are bone cells surrounded by calcified matrix. Osteocytes remain in contact with one another and with osteoblasts via long protoplasmic processes that run through channels in the bone, forming the functional syncytium. Osteocytes provide rapid and transient movement of calcium from bone into the ECF space. Mechanism of formation of the bone. The initial stage in the bone production is secretion of collagen molecules, that is, which are called as collagen monomers, and ground substances that are proteoglycans by the osteoblast cells. The collagen monomers polymerize rapidly to form collagen fibers. The resultant tissue becomes osteoid. As the osteoid is formed, some of the osteoblasts become entrapped in osteoid. At this stage, they are called osteocytes. During the normal process of mineralization, minerals accumulate within the membrane-bound vesicles. Within a few days later or few days after osteoid is formed, calcium salts begin to precipitate on the surface of the collagen fibers. This process is controlled by parathormone, calcitonin, and 1,25 dihydroxycholecalciferol. Parathormone and calcitonin decreases the permeability of the bone cells to calcium, while 125 dihydroxycholecalciferol facilitates the active transport of calcium from osteoblast into extracellular fluid. In this way, calcium and phosphate concentration in the bone fluid is regulated. Osteoblasts secrete an alkaline phosphatase that hydrolyzes the phosphate esters, and the phosphate is released. Thus, whenever calcium phosphate ratio exceeds the soluble product, the calcium phosphate precipitates. Reabsorption of the bone. It is a process that involves destruction of entire matrix followed by removal of calcium. It is brought by osteoclasts. Osteoclasts, as we had discussed, they are phagocytic multinuclear cells formed in the bone marrow. When osteoclasts are activated by PTH, some proteolytic enzymes and several acids like citric acid, lactic acid are released, and enzymes digest or dissolve the organic matrix of the bone, and acids cause solution of the bone salts. All the dissolved materials are then released into the blood. So this diagram showing different cells like osteocytes, osteoclast and osteoblasts. Osteoblasts are bone forming cells and osteoclasts are bone dissolving cells where they're going to increase the calcium levels, and osteocytes are the bone cells which through the canalicular system they help in the in a contact between different cells and also with the different osteocytes. And osteoblasts, these are the cells which are able to maintain the concentration of the parathormone. Under the influence of parathormone, they will be able to increase the calcium levels in the osteoblast, and the calcium is pumped out of these osteoblasts, and the dihydrocholecalciferol also helps in the movement of calcium from the osteoblast cells, thus